Our aim is to use microbubbles in combination with ultrasound in order to safely open the blood-brain barrier, or the BBB. Microbubble excitation is typically being performed at ultrasound frequencies of between 1 megahertz to 5 megahertz. These range of frequencies are the same frequencies where the resonance frequency of the microbubble lies, and therefore it was assumed that microbubble oscillations will be maximized around this frequency. However, the use of a lower ultrasound frequency is desirable to enhance the penetration depth, to increase the focal spot, hence allowing to treat a larger volume simultaneously, and specifically for BBB opening applications, focusing through the human skull can be performed with minimal attenuation and distortion as compared to higher frequencies. And here I'm specifically talking about a frequency of 250 kilohertz. This frequency is over an order of magnitude below the resonance frequency of the microbubbles, and therefore it was previously assumed that the microbubble oscillations will be reduced at this frequency, and that higher peak negative pressures will be needed in order to excite the bubbles and cause them to oscillate. So our research and our aim was to characterize the oscillations of the microbubbles following a 250 kilohertz ultrasound burst. We used a few experimental tools. We used optical imaging as well as passive cavitation detections of isolated microbubbles within 200 micron cellulose fibers, and then used similar parameters in order to open the BBB in mice, and evaluated this opening by measuring the contrast enhancement using an MRI. So we started by comparing the oscillations of microbubbles at two different frequencies, a 1 megahertz frequency, which is a standard frequency, and a 250 kilohertz frequency. Here what you can see are streak images that represents the diameter of the microbubble as a function of the time. For the 1 megahertz, if we calculate the expansion ratio from this image, the expansion ratio is about 1.6. But when we use the same peak negative pressure of 400 kilopascal, but just use a lower frequency, the 250 kilohertz, you can see that the expansion is greatly enhanced and reaches a factor of 30. So these results suggest that not only that microbubble oscillations are reduced at lower frequency, they are actually enhanced. Then we characterize the oscillations over a wider range of peak negative pressures up to 500 kilopascal. And here again, the experimental results of the 250 kilohertz, both in using optical imaging and passive cavitation detection, showed a great enhancement compared to the 1 megahertz. And notably, also theoretical predictions of the microbubble oscillations at 250 kilohertz performed using the Rayleigh-Plasat equation and the Marmatent model were in good agreement to the experimental results. Then we were particularly interested in evaluating the range where the expansion ratio of the microbubbles is between 1.1 to 3.5, and use this range of expansion ratios to do the blood-brain barrier opening in mice. So if we will look at the expansion ratio graph, and we can determine that the peak negative pressure that corresponds to this expansion ratio is between 75 to 190 kilopascal, and these are the range of pressures that we use for opening the BBB in mice. So post-treatment, we injected the mice with MRI contrast, which was ProHance, and imaged them. These are coronal MRI images of 4 different pressures along the curve, 75, 100, 150, and 190. At the mice treated with 75 kilopascal, we saw no contrast enhancement. At 100 kilopascal, we saw some contrast enhancement where we treated, and this contrast enhancement increased as a function of pressure. However, the mice that were treated with 190 kilopascal showed signs of neurological damage, which was also validated using pathological evaluation, where you can see here that at 150 kilopascal, the brain tissue seemed to be normal, whereas at 190 kilopascal, we saw signs of edema and hemorrhage. Here is a graph that shows the contrast enhancement that we measured in the mice as a function of the peak negative pressure. So basically, only at two settings, the 100 and the 150 kilopascal, we saw BBB opening that was also safe, and that matched quite well the in vitro results, where we estimated that within this range, the expansion ratio of the microbubbles is between 1.1 to 3.5. And the giveaway message from my talk is that for our setup and our configuration, safe blood-brain barrier opening is feasible. However, it requires consideration of the narrow window of pressures between stable and inertial cavitation. And these results were accepted for publications 4 days ago in scientific reports. Thank you.
Questions?
Affinity or a homemade microbubble mix?
So these are homemade microbubbles. Their size is about 1.5 micron, and they are lipid shelled. But we also used some Sonoview microbubbles, and it showed the same trend.
Okay.
Is there some plan to do more of in vivo work, maybe with large animals, so that we can have some guidance for the clinical treatments as to what that window of safety of BBB opening is in terms of parameters that we can measure, like energy and those kind of things during human treatments?
Yes, so we do plan to go forward with larger animal models, and basically the question there is the attenuation of the skull, and we do plan to do that.
Could you tell if the shell broke from the high-speed imaging? Or when it broke, I suppose is the right question.
So we saw that the microbubbles broke at the when they encountered the second cycle of the ultrasound, typically. However, and we also saw that some of the bubbles fragmented, meaning that they formed new smaller bubbles. So it is likely that we do. Yep.
Okay.